What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
Auto insurance can all seem the same until it comes time to use it. So don't get stuck paying more for less coverage. Switch to USAA Auto Insurance and you could start saving money in no time. Get a quote today. Restrictions apply.
USAA. Introducing our biggest GMC Acadia ever. Offering bigger screens, bigger views, and even bigger journeys. Live your biggest life in the all-new GMC Acadia.
What do you get when you cross a broken ice cream truck with impressionist art? Van Gogh. What did the compost say to the coffee grounds? Let's get dirty. Why don't you ever see Lego trolls on Twitter? They've all been blocked.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. Now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical practitioner who gives me street cred with the whack alternative medicine asshats. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacie. Hello, Tacie.
Hello.
This is a show for people who would never listen to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, respiratory therapist, acupuncturist, whatever. Check out stuff.drsteve.com. That's stuff.drsteve.com for all of your, Amazon needs. Online shopping needs. Hell, they got everything. It really helps keep us on the air.
Yep.
So stuff.drsteve.com. Thank you. And check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And patreon.com/weirdmedicine, where Tacie and I will again be doing shows now that we're back from vacation. And it's fun. It's a different show. It's completely different content. And then there's some classic stuff that you've never heard before. There is the first time I was ever on Opie and Anthony on there. I just put some links up to 3 major times that I took a major thrashing on that show. That all in good fun, of course, and it was loads of fun. And particularly the time when they had been giving them wine, homemade wine. And that's where this all started. Steve from Bayshore still shits on me about my homemade wine. I haven't made any wine in, 20 years? But back then, I was making wine quite a bit. Well, 20 years is too much. Probably 15. But and I sent them some. And Opie, they were talking about taking gifts from fans. And Opie said, you know who gave me homemade wine? And I love the guy, Dr. Steve. And then here we go. Well, it was made from aspirated cysts and all this stuff. And, of course, I can't do it justice. And I heard it live, and I remember thinking, oh, God, is this good or bad? And then the more I listened to it, the funnier it was. Scott, if you've never heard this, it is really funny. And they were just, it seemed like 45 minutes. It was probably 12, 15 minutes, something like that. But that's on there, and it is quite humorous. And that was the first time, Tacie, and I think you probably remember this, when I realized that I was kind of in the group, even if I was in a very even if I was Pluto to their solar system, okay. I was still felt like I was orbiting. I was part of that sort of local group, so that was pretty cool. Because they were just shitting on me so bad, they wouldn't have done that if they didn't like me. So anyway, all right. And check out cameo.com/weirdmedicine. I do them dirt cheap. I'll say fluid to your mama. I had a guy do one for his dad who was 60 and wanted me to just say fluids a bunch. And so I did that. And I told him the story about Dave Cole with his first auctioneering job where he had to say sickety, sickety, sickety all over and over again because the stupid property got stuck on 60. And they can't say 60 if you're an auctioneer. Because try saying 60 multiple times real fast. You can't do it. 60, 60, 60. But you can say sickety, sickety, sickety. You can do that real fast. Yep. And his wife turned to me and said, yeah, he's making me sickety. I wish he'd shut up. So it was a fun day. But anyway, so I do stupid stuff like that. So it's terrible, but it's terrible in sort of the weird medicine way. So cameo.com/weirdmedicine. So Dr. Scott. We'll get to my medical issues in a minute. We left everybody kind of on a cliffhanger last time. But let's talk about yours. You've been having some belly pain, and now, what the fuck? You had a colonoscopy today?
No, that's next Wednesday. Today I'm just foggy because I had an endoscopy.
Oh, now the endoscopy I'll do with anesthesia because they can't stick a 6-foot snake down my throat without me just puking up my stomach like a dang... swordfish that's brought up from the bottom.
Yeah, and that's kind of what it looks like. So I did the propofol, which has got to be the best drug ever.
Yeah, it's Michael Jackson's Magic Milk. Oh
my God, it's just the most bizarre thing.
Yeah. No, it is weird, isn't it?
It's just because you're perfectly lucid.
Yep.
And the anesthesiologist taps me on the shoulder. She goes, "Now, honey, you're going to go to sleep here in just a second."
And you're like, "Yeah, right."
And I'm like. And then you wake up, and I felt really good most of the day. I'm just a little foggy, just a little. Yeah,
you feel,
but not bad. Not
more
bad.
Like you could do stuff than you really can.
And I think that's the problem I got into today. Doing the show, I thought I had everything under control, and then the computer's not working. I'm like, oh man.
Yeah,
my brain's not quite back to full speed.
You lose what they call executive function.
Yes.
But it is interesting.
And I don't have much to work with either.
My experience is they say, okay, we're going to give you the medicine. And I'm sitting there going, this isn't doing anything. But when I'm thinking that, it's already over.
Oh, yeah.
I'm sitting there going, well, this shit isn't working. Yeah. And then they're like, okay, you can get up now. It's like, wait, what? I missed the whole thing.
Yeah.
It is amazing.
Yeah,
anyone that fears this do not fear this.
It's literally it's the coolest thing I've ever done.
It is cool. It's like time travel.
It is. It's just, you just literally just go, because you're sitting there having a normal conversation, and then you wake up, you're like.
Well, in the middle of a word, and you finish the word.
Yeah.
And it's already over. I remember the first time I had it done, we had an anesthesiologist. His name was Willie Abrenica. He was from the Philippines, and he taught me all kinds of disgusting words in Tagalog. So for any of our Tagalog speakers, if your Tagalog-speaking moms are listening, cover their ears. But he taught me putang ina mo. That means you son of a bitch. And then malaki susumo. That's you have big tits.
Ooh.
I don't know when I would ever use that one.
No, never.
Right taste. And then let me see, mabaho ang kili mo. That means you've got BO. Kili is like stink under your armpits. And then I would always get everybody to teach me how to say, what's that hanging out of your nose? And I can say that in a bunch of different languages. In Tagalog, it's anong nakasabit sa long mo. Now in Urdu, which they speak in Pakistan, it's nakachoha.
Oh, God. That's a lot better.
Nakachoha.
That's a lot better.
And then, I can say it in Romanian, too.
But that's probably enough, though.
No, okay.
Oh, he's just showing off.
I know he is.
He's covering for me.
Okay, go ahead and tell us.
So anyway,
everybody that's Romanian
so
is just waiting. They're just waiting.
No, it's fine. It's a
they
cliffhanger.
want their
Tacie says no.
Represented.
Tacie said no.
They want to be represented, too.
It's Chitsatir Nadinas.
I knew you couldn't help it.
Well, you said so, but yeah, so Willie Abrenica, I remember I was terrified that, because I'd never been under anesthesia before, that in the middle of it, I would start screaming horrible things.
Right.
And then there's no saying afterward, well, that wasn't me. No. You know, I didn't say those because people would be like, that's the way he really thinks. But it's like, no, I'm so worried I'm going to scream something inappropriate that, like a Malaki Susumo or something like that. I'm sure that's what it would be. That I was really worried about it. But then I had that exact experience. They gave it. He said, "Okay, I'm going to give it to you now." And then I just woke up and it was over. And it's like, what? It's over? And I was like, Willie, I was screaming at him in Tagalog what an awesome dude he was, and all this stuff was great. So, oh my God, that was quite the relief.
Yeah, I'm up.
Now,
well, this is part one.
Now, why are you having this done? Because then we'll talk about part two.
Part two. We just having abdominal, really diffuse abdominal pain for many, many years. And
you never told me any of this stuff.
You've got other things.
No, I
about.
don't.
Yeah,
You're my friend, you fucking asshole.
You've got lots of other people to worry about.
Oh, you just don't want me doing it.
That's not true. That's not true. No, but we thought it was, and still think it's.
Who's we? You and
not primary.
You and Beardy.
Yeah,
Blackbeard.
It's his. One of his minions.
Okay, doesn't matter.
But you know who it is.
Yeah.
It's like
okay.
He's a fancy British accent.
Yeah. I know who he is. It's South African, but I know what you're saying. Yeah.
But we're just thought it was irritable bowel, really. So what I've done is, and I've changed a lot of things. I've gone primarily to the FODMAP diet.
Yes.
And that has helped a bunch, and just simply cutting out onions and garlic has made a huge difference. Yeah, but hell, you grow up thinking all that's good for you, but there's a lot of other foods and vegetables on the FODMAP diet.
Yeah, we should talk about
that are
FODMAP.
Very, very, very healthy for you, but they blow up your tummy.
Yeah.
So I was just ruling out, because there's a bunch of.
Well, let's talk about it since you brought it up, so we don't have to go back and talk about it. We put Liam on FODMAP diet as well, and I'm sort of on it, but it stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These are all short-chain carbohydrates, i.e. sugars, and the small intestine can't absorb them very well. And what happens is then you get bacteria that'll crack these things, or the body tries to metabolize it, and you get cramping, diarrhea, sometimes constipation, stomach bloating, and gas and flatulence. So and these these foods include things like milk, yogurt, ice cream, which Liam will not stop.
Yeah, I haven't had that in years.
Well, he takes Lactaid, but and then wheat-based products, so you go gluten-free. But then, yes, like Dr. Scott said, there are some vegetables in there that you would otherwise think are very healthy: onions, garlic, asparagus, artichokes, apples, cherries, pears, and peaches.
Yeah. I know,
broccoli, stuff like that. So
things that you would think are just wonderful.
But they're gas. They have these sugars in them, and the body can't digest them well. And you don't want to be presenting undigested sugars to the bacteria in your gut because they just go, it's a fucking smorgasbord.
They love it.
So, so you have to base your low FODMAP meals around things like eggs and meat. certain cheeses, and thank God, cheddars in there, almond milk, rice, quinoa, oats, that kind of stuff. But you can have vegetables, eggplant, tomatoes, cucumbers. You can have zucchini. They talk about cucumbers. They have those burpless cucumbers because people have indigestion with them, but those aren't a problem in this.
No.
But that is, if FODMAP helps you, it makes me wonder, since you've had abdominal pain for so long, whether you have small intestine bacterial overgrowth.
SIBO, yeah. I think
have they discussed that with you?
So we did a round of
rifaximin.
Well, not that, because it was $700.
You can get it less than that.
Flagyl Cipro combo.
Oh, God,
that's
that must
fun.
have torn up your stomach.
Not at all.
Really?
Not
Didn't
at all.
bother
It
you?
helped. No, hell, it helped. It's wonderful.
Oh, yeah. Well, if it helped, then that's got to be what
It's got to be, and that's what, again, we're just kind of, and I hadn't had a colonoscopy in years, and I just loved the experience, so I thought, have another one.
So let's talk about your colonoscopy then.
So that's coming up next. So please, I'm going to ask for forgiveness from our friends in advance, because next Wednesday I'll probably be in similar shape.
Oh, really? Oh, you're having it a week from?
Yeah.
Okay.
Yeah. And,
so that's awesome. Yeah. Do it without anesthesia. Try it one time. Try it.
Oh, yeah, just try it.
No, seriously.
It won't hurt.
I wrote, if anyone is interested in what I'm getting ready to talk about, or what we're getting ready to talk about, go to drsteve.com and just put in the word colonoscopy in the search bar, and I wrote up a whole article. That was back when I thought I would write a lot of things for the website. A whole article on anesthesia-free colonoscopy. Mm-hmm. And, well, you've heard me talk about
it. Oh, sure. Yeah.
The downside is, yes, you have to, if you look at the TV screen, you will see a 6-foot rendition of your hairy anus before it goes in. But the upside is you can see stuff. You can see the transverse colon, and you can see the cecum, and you can see all these parts of the large bowel, which is pretty damn cool. And they can talk to you during it. There is mild discomfort unless it gets stuck, and then it hurts like a motherfucker, but for like 30 seconds. Yeah. And then it's done. And when they pull it out, and they use nitrogen now, which pissed me off because there's not even any post-procedure flatus. I took a flatus flute with me last time thinking, oh boy, I'm going to film this as I expel all this gas and make the flatus flute shoot out of my ass. And go to flatusflute.com, by the way, if you're interested in getting one. It's the whistling bug plug. We have nothing to do with it, but it's hilarious. And I thought that would be cool, but now they use nitrogen. It just gets absorbed, and there's no post-procedure bloating.
The post-procedure bombs.
And the prep, it sucks, except that you feel so much lighter on your feet with no shit in your colon.
Yeah, oh heck, yeah, I don't mind that. I don't mind that part at all.
Yeah, and you never ascribed all this BS like these bowel people on the internet where they're like, oh, and I took this preparation and look at the leathery concretions, and they take a knife and they're cutting these leathery things, and they're talking about how stool cakes the lumen of the bowel, so you only have this little channel, and it's like it makes sense in your head that it would happen that way, but that's not how it happens. No. There's none of that. Anyone that's ever seen a colonoscopy knows that this is a lie.
Yeah.
And they'll say, well, what about those things that they pull out of their ass? And it's like, that's the thing that they're taking. It's some fiber product that binds together, and then they shit out these giant masses of fibrous stuff, and then go, see, and they'll pick them up with a stick and go and point it at the camera. Just go Google. You don't have to go very far to find this stuff.
No.
Yeah, I've never Googled that.
Bowel cleanse.
Hey, we've got a Keith from L.A. said he tried to do that, and they refused. They wouldn't let him take his colonoscopy.
Really?
Yeah. Yep.
Dude.
Keith from L.A. Yeah.
From L.A. Well, that's why, because they want to talk about him when he was out and stuff.
Well, it's an extra, procedure and money and stuff.
Well, it is true. You save money by doing it my way. That's weird that they wouldn't let you do it. I'm not sure that I'd be okay with that.
Yeah.
That should be optional.
Yeah, should be.
But anyway, and then when you're done, you just pull up your drawers and you go. You can drive. You just go back to work. You do whatever you want. You don't have to take a whole day off. You don't have to feel goofy and out of sorts from that propofol thing. And I recommend everybody, if you're going to have 1 or 2 colonoscopies in your life, try one of them without anesthesia, unless you just are completely skeeved out by the idea.
No, I could do it. Maybe a little quarter of a Xanax or something before.
Yeah, you could. You put it under your tongue.
Exactly.
Slip a little Twix cheek and gum, don't you know?
Between a cheek and gum, I'm thinking that'd be a good thing.
That'd be all right for you.
Yeah, I might have some other things that might help calm me down before that too.
I don't know what you're talking about there, Dr. Scott. Well, anyway,
fun.
Yeah, so I hope that you feel better. I still would probably do the rifaximin. I'm thinking about getting them to put Liam on it.
Yeah.
Small intestine bacterial overgrowth syndrome, I think, is pretty grossly underdiagnosed.
Terribly underdiagnosed.
There are tests for it.
Yeah.
There's a thing called urine for indicans. Go ahead and talk about.
Well, and sometimes they'll give you the breath test where they'll have you blow into the bag and after you swallow some stuff. And so there's a bunch of different things, and but the great news is I was completely cleared of any kind of gluten allergy.
Yeah.
Which I can't wait to get my stomach fixed so I can start drinking beer again.
Well, okay. So you may be gluten sensitive rather than gluten allergic, which means you can drink beer. They do make gluten-free beer. You and I used to sell it.
Yep.
So
not much of it though.
Yeah, no.
I don't think the flavor
sell
was
much
great.
Anything. But.
Well, it's hard to sell when you got somebody giving it or trading it for pain pills. If you remember.
Yeah, that is true. That is true. That's a problem. That put us a little behind there for a while.
Shit. Look at this time, Dr. Steve.
Yeah.
Let's get late.
Tacie's just shooting daggers out of her eyes.
Yeah,
when we opened
daggers go both ways.
That I said. It wasn't going to be my issue, and I wasn't going to worry about it.
Yeah.
So
and you violated the second half of that.
I did not worry about it that much.
No, you did good.
It was at least we did have a good place to play some music, though.
Oh God, yeah, that's the thing I miss about it. You know, one thing when you own a fucking beer garden, you get to book the act. So we would have some pretty cool people like Dave Cecil and who are those guys? Kramer's kid. What's his band's called?
Oh yeah. It's
people need to probably.
They're actually very good.
I know. I was going to say they ought to check them out on YouTube. Well, if you think of it. Anyway, but we had real musical acts there. We had R-Hat do. You could check him out. It's ARHT, I think. And he did techno music, and then we had some people do, Dave Cecil does acoustic stuff, and these other people were pretty cool.
Donnie and the Dry Heavers.
Yeah, Donnie and the Dry Heavers. Check them out.
Yeah, they're actually very good.
On YouTube.
And they're getting much better, too. They're playing a lot.
And,
I know people who follow them.
Yeah, they're very good.
Yeah.
Mm-hmm.
Yeah, they're pretty
good. Yeah, so they were great. We had them. And then there was Dr. Scott and Dr. Steve
That's right.
playing Grateful Dead covers.
Free music is
That's
what
true.
It's
There
called.
was no cover.
That's right. Hey, Talk Like a Hick's got a great quick question. Is SIBO the same as or similar to H. pylori?
Do you want to take that?
That is a great question.
That is a great question. Tacie can take this one.
No, I was actually going to ask that question.
Oh, okay.
No,
right.
they're similar but completely different. The H, well, it's
similar.
It's the same except different.
It's similar in the fact that the H. pylori is a bacteria.
It's a
in
bacteria.
The stomach,
That's the only thing.
In the stomach, yeah. And that's what I mean. SIBO is bacteria in your colon.
That's right.
So versus your stomach, yeah.
So now,
SIBO is by definition is in the small intestine.
Not colon. Small bowel. Yeah, I'm sorry.
So back when I used to know about this stuff, they did breath tests for H. pylori.
Right. Yep.
And then H. pylori kind of went out of fashion a little bit.
Yeah.
Well, they test everybody for it if they do an EGD, endoscopy.
It's just like what I had just wasn't a big thing. It was a big thing, and then all of a sudden it's like, oh, H. pylori, whatever.
Well, the funny thing is that when I was training gastroenterologists, if you said to them, what about this H. pylori causing stomach ulcers, a bacterium in the stomach causing stomach ulcers, they would literally laugh at you, saying there's no way in hell that a bacterium can survive in the stomach to cause ulcers. And then it was demonstrated through using Koch's principles that, in fact, that is exactly what happens in certain people. And then, there's this regimen. Do you remember what it is, Tace? It was clarithromycin, amoxicillin, and lansoprazole, right? There were 3 drugs that you had to take to kill this thing. And it was kind of a pain in the ass regimen, but it would kill it.
Right.
And you would, when you killed the H. pylori, the ulcers would heal faster.
So you get that test every endoscopy
Yes.
you get?
That around here, anyway, I'm sure that's everywhere. It's so cheap.
So what about these newfangled products that are out that you were talking about wanting to put our son on?
Now that's for small intestine bacterial
I was
overgrowth.
wondering if it would kill both.
That's an interesting question. I don't think so.
I don't think so either.
H. pylori is hard as fuck to kill. You just think about it. It lives in the stomach where the pH is 4.
Acid. It lives in acid.
It literally lives in hydrochloric acid, so it's a little harder to kill.
Yeah.
But small intestine bacterial overgrowth is where you maybe you've been on acid suppression, and now some bacteria that can't live in the stomach now can live in the stomach, enough of them to get into the small intestine, because the small intestine is supposed to be relatively sterile. And then you get this kind of slime layer in the small intestine that's just bacteria going, where's the chow?
Where's the juice?
And then you feed it things like bread and things like that, and
milk
and any sugars that can't make it. Oh, that's one of the problems with lactose intolerance is when, lactose is the sugar in milk, and it is a oh shit, now I got to look it up. I don't want to say this wrong. It's a disaccharide. They're 2 sugars hooked together, and I can't remember if they are both glucose or one is a different thing. God dang it! Come on.
And I'll add while you're looking at for SIBO too. One thing you can tell that I've experienced is with SIBO.
Sorry, okay, I got it.
Okay, is that if you drink something carbonated, that helps to carry the bacteria in that small intestine further down the small intestine.
That makes sense. Yeah,
sure does. So the bacteria actually, the bubbles in the carbonation actually carry it down. It makes it worse and worse over time.
Yes.
And I really, it's been a couple months ago, but heck, I just took a little sip out of one of those waters, the flavored waters that are carbonated, and I thought my daggum stomach was going to just explode. I said, "This has got to be it."
Yeah, that's interesting. And Liam has trouble with carbonation too now. So, lactose is a disaccharide, as I said, but it's galactose and glucose. So it's 2 different sugars together, and what lactase does is cleaves those 2.
Okay.
So, and when you cleave them, they can be readily absorbed in the stomach and very early in the GI tract. But if you can't cleave them, they can't be absorbed, and they end up in the small intestine. And if there's bacteria in there, they go, "Ooh, we like this stuff," and they'll ferment it. And when products of fermentation are gas and alcohol and stuff like that, and then if those things make it to the bowel where there's just nothing but bacteria, then it's really a problem. It causes bloating and gut discomfort and stuff like that. So anyway,
and I think a lot of folks don't realize that inside especially in the intestines, the stretch fibers in there.
Oh, and they don't like it.
Oh God, no! Those stretch fibers, they start getting stretched out with.
So stretch fibers are nerve endings that respond to stretch, and what they're trying to tell you is something is breaking in there.
Something about to blow up.
Yep, and so they're not designed to just be stretched taut, and that can cause a lot of discomfort. Also, if you get cramping with it, which you will get with this because it causes not just inflammation, but just irritability of the bowel, and now you start getting cramps and those kinds of things as well. So the whole thing sucks. And but it may be caused by us taking antacids, and now all of a sudden these bacteria can survive to get into the small bowel. So we use a medication called rifaximin usually for that, and it's a kind of broad spectrum antibiotic that kills gut bacteria. Yeah. Then you want to follow that with something that will repopulate your bowel. And see, it's always tough for me is that you take probiotics, and then they've got to pass from the stomach to get to the colon, So now you're just repopulating that area, but at least you're repopulating it with good bacteria instead of shitty bacteria.
Yeah, and I've actually found a couple of products I like because, the thing I can't do is like the kombucha.
Yeah.
Because it's all carbonated.
Right.
So it's like,
you shouldn't be drinking that crap.
I was going to say, I'd like to use it, but heck, I can't because it blows up.
I mean, it fits your personality.
It does. It probably smells a lot like me, too.
Weed-infused kombucha.
Wait a minute. New idea.
That's actually not a bad idea. We could sell it to all those damn hippies.
That's for a bunch of hillbilly hippies.
All right. So anyway, we're going to get an update next week.
Yeah.
On your colonoscopy.
Looking forward to it. Yeah. And to be clear, the great news is, like I told the doctor this morning, I said the great news is you didn't find anything. That's what I was hoping for.
Yeah.
A little gastritis, so there was some little redness in my stomach. It really is crystal clear.
Yeah.
No Barrett's esophagus, nothing. Everything
that's
good. Yeah, look good.
Barrett's esophagus being what they call metaplasia, where the squamous cells, which are flat cells of the esophagus, are replaced by glandular cells from the stomach. Mm-hmm. And it's a response to acid, right, Tace?
Yes, and it is a precursor to cancer.
Yeah, so because it's metaplasia, meaning that there are cells there that aren't supposed to be there, and they are subject to more stress because they're not supposed to be there, and they can become malignant. So it is a risk factor, and you want to get that checked. So if you have chronic dyspepsia or acid reflux or heartburn, which we call pyrosis, and you're just treating it with over-the-counter shit, at least tell your primary care provider about it, because those folks, we used to say if they took something over the counter for 6 weeks and couldn't get off of it, they needed to be scoped just to make sure that we are establishing a baseline, we're not missing anything. Mm-hmm. That was when they first came out with these things over the counter. I was kind of pissed about it because we had a protocol. We would put people on ranitidine back then. That was the big thing. Or cimetidine was the first one. Mm-hmm. And then men were growing boobs and stuff with cimetidine. So we started switching people to ranitidine, which now is off the market. And now the only one that's really left is famotidine, and which is Pepcid.
Right.
But we would put people on those. But if after 6 weeks their symptoms didn't go away, they were going right to the GI and getting scoped. Yep. And I felt like that was a safer sort of paradigm rather than you just sell it. Somebody takes this stuff for 10 years and never tells their primary care about it.
And that happens a lot.
Yeah, at least tell your primary care if you're taking those.
Happens a lot.
All right.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
Hear that? Yeah, that's the sound of you relaxing, because now you're managing diabetes with the Freestyle Libre 3 system. You get to know your glucose levels and where it's headed. Manage your diabetes with more confidence with the Freestyle Libre 3 system. Ready to learn more about the #1 prescribed CGM in the U.S.? Visit freestylelibre.us to learn more. Based on retail sales data for patients' last filled prescription by manufacturer. Refer to the FLAIR NL4 study published in BMJ Open Diabetes Research and Care 2019. Safety info found at freestylelibre.us.
ABC Wednesday. It's the premiere everyone is talking about.
I'm Joan, and I'm your first Golden Bachelorette.
Loves getting a second chance.
When you're 61 years old, you have very few opportunities to change your life. I have to be ready.
The Golden Bachelorette is proving romance never ages.
I represent millions of people in their golden years looking for love.
The Golden Bachelorette.
I am ready to find the next great love of my life.
Series premiere Wednesday on ABC and stream on Hulu.
If you send hey, they send hey. But with opening moves on Bumble, you can get to better chats faster. Because if you send most underrated summer activity, they send eating spicy soup in front of the air conditioner on full blast. And that's something you can work with. You're still making the first move, but you can choose a question or write your own to get sent to all your matches. So you can relax and see what they come back with. Download Bumble and try it for yourself.
Well, I guess we should probably give people an update on my thing for those that weren't listening to the last show before we went on vacation. The day before vacation, my primary care said we need to get a CT scan on you because the chest x-ray we did showed that you may have some what we call pulmonary fibrosis. And the reason they did the chest x-ray is because they'd forgotten to recheck the chest x-ray after I had COVID, and which showed a weird sort of hazy place in the left lung. Mm-hmm. So I said, okay, well, that's fine. Pulmonary fibrosis, if I have that's often a 2-year prognosis if you get the bad kind. And either way, you're going to have some real decrease in real challenges. Yeah. So I was kind of bummed about that. Well, so I get the CT scan, which now takes literally 30 seconds to do, and I kind of bullied the technologist to just show me the films, right? And they start at the top of the lung, and so it's as if your head is behind the screen and your feet are sticking out of the screen. So your spine is down and your sternum is up, and then they're taking cross sections. Mm-hmm. And so it started at the top of the lung, and it was nice and just homogeneous with proper looking blood vessels and the little bronchioles. I said, well, that looks good. I don't see any pulmonary fibrosis in there. And then we go down further, no fibrosis. Hey, this is looking good. Oh, so far so good. What the fuck is that? And the very last 10 things, there was this giant crab in the lower part of my left lung. I said, well, show me the coronal views. And that's where they go, how can I explain that? Shoulder to shoulder, okay, cutting you that way. Right. And then I could see it, and it looked like a wedge-shaped piece of shit.
Yeah, it looked like almost a jagged stone.
Yeah,
rock
bright
thing
white-looking thing that was going from
granite.
In the
like
left,
granite,
lower left. Yeah, it looked like granite.
It
That's
really
right.
did look like granite. Yeah.
So, and that's an artifact of the way that the imaging works. And I'm like, oh my God! And I was really at the time, I was like, okay, I've got stage 3 lung cancer. I came home and told Tacie, listen, this is what's going to happen, and I don't want any...
He said, cut the bullshit.
I don't want
to hear it. And
Right.
I was like, what? I didn't even... Okay.
No, well, and I said, this is what we're going to do. I'm going to drive you down to Isle of Palms, and then I'm going to turn around. I'm going to stay till 4th of July. I'm going to turn around and come back. I'm going to have a bronchoscopy on Tuesday, and then I'll come back down on Wednesday. And because I can't let this just be hanging over my head the whole time. And but I have friends. I've been here for 35 years, and so I've got a really good friend named Kevin who's a pulmonologist, and I sent a picture to him because unbeknownst to the technologist, I snapped a little picture of that coronal view. And I sent it to him. I said, what in the hell is this? And he said, is that you? And I said, yeah. He said, that looks like fibrosis from COVID. We're seeing this all over the place. Wow. We're seeing tons of it. Mm-hmm. And I think that's what it is. But let me call the radiologist and see. And he called the radiologist and he said, yes, this doesn't look like cancer. But they kept saying, we're pretty sure it's not cancer. So I've shown it to 3 other pulmonologists. The last one had a really interesting thing. He said, when you had all that coughing, because I coughed for like 6 weeks after I had COVID, he said what might have happened was you might have inhaled like a piece of popcorn or something if you were eating popcorn. And when you take that big breath when you're getting ready to do a huge cough, and if you had inhaled that and it got stuck in one of these small little bronchioles down there, it would have done the same thing. The bronchioles, it starts with the trachea, the big windpipe, and then it separates into the 2 major
big
bronchi. To each lung, and then it divides and divides and divides and divides and divides to get smaller and smaller. And so this piece of popcorn may have gone all the way down to the bottom of my lung and just got stuck, and I couldn't cough it up. When that happens, it's just going to kill the everything on the other side of that little bronchiole that got plugged up, and it can look like that. Yeah. So they're going to repeat it in 6 weeks, and then we'll know for sure. And but I did put, if you want to see it, check my Twitter feed at Weird Medicine. I did put it up there and kind of explained to everybody because I knew last time, I kind of was cryptic about it, and I don't think I gave a very good, discussion on it because I was pretty freaked out anyway. So, but that's what it is. And so, I can live without that little chunk of lung. It's totally fine. Yeah, fuck that piece of lung. But it does give you pause when you think, oh, this is it. I'm going to have to do chemotherapy and, God knows whether I'm going to be here a year from now. So, but then after a couple of weeks, you just go, oh, shit. Go back to doing what you were doing before. Yeah. I remember I had a car wreck once and I almost died in it, and I was like, oh, I'm going to change my life. I'm going to be a different person. That's like, fuck it.
That didn't last
After
long.
about a week.
Those scare tactics have been shown to not work at all.
Yeah. I did do some reflection and stuff. And I shut down my social media while we were at the beach. And just said, listen, I told everybody what was going on because I knew I didn't want anybody to think if I just disappeared that something bad had happened. Because I do care about our listeners. And we have amazing listeners. The support that I got after just letting them know I had a health scare was outstanding. And I just want to tell you all, I love all of you. I really do appreciate it. And
all the good wishes.
Yeah, no, it was awesome. Well, you ever think of, I'll just pretend I'm dead like Tom Sawyer and then see what people say at your funeral. And now I don't have to, and I appreciate that because people thought I was croaking. But I do appreciate it.
That's good stuff.
Anyway, so I'll keep you in the
6 weeks, huh?
Yep.
That's cool.
Yeah, and if it's still there, if it's grown at all, because the third pulmonologist said this could get bigger if this was more recent than we thought, except it's right in the same place where the COVID hazy place was. So it's got to be that.
Yeah, and I was going to ask you that too, Dr. Steve. Did they tell you that other people that they've seen with the COVID lung, the scarring in the lung, does it seem to progress, or does it seem to be pretty stable?
Yeah, it's just there was so much inflammation that part just kind of got clogged and it couldn't unclog. Maybe a mucus plug, if you've heard of that. And I wondered at the time whether I had a mucus plug because I was coughing so bad. You remember, Tacie? I was just coughing my stupid head off. And I thought about a mucus plug, and I just kind of went, fuck it. But, if I get COVID again and that shit happens again, I'm going to do a special breathing treatment called N-acetylcysteine, and it will break those things up.
And you're going to call me because I have medicines for that.
You do?
For the
lung. Mucolytic stuff?
Yeah.
It's
wonderful, yep.
What do they do for mucus plugs? Because I think I had one.
Yeah, you may have.
A long, long time ago. I remember coughing literally, this is disgusting, a brick up.
Oh, yeah.
Like it was hard as a rock.
Yeah.
And I coughed it up, and it was just
a broncholith. Was it shaped like a bronchial?
It was just like a
tube.
Yeah, it was just a rock of mucus.
Yeah.
And I had been coughing and coughing and coughing for months.
Yeah, that's probably what that was.
I was smoking.
Mm-hmm.
And in my early 20s. So.
Yeah. You were hot though when you were smoking back then. Mm-hmm. Hanging out of the window at the Thistle Victoria in England, smoking in a non-smoking room, out on the balcony with the gargoyles. It was awesome. God, she was hot.
Well, they didn't really mean non-smoking back then.
No, they really didn't.
It was just a suggestion.
It's true.
Now it's like $400 fine, and
well, it's like I would not stay in a room if I smelled smoke anymore.
I wouldn't either.
That's how bad I've gotten, or how over it I am.
Yeah.
But anyway, yeah. So they can do bronchoscopy, which is where they give you goofy juice, stick a fiber optic scope down into your lungs, and they look around, and when they find the mucus plug, they just suck it out. Mm-hmm. And they can lavage it with saline, and they'll dump a bunch of saline in there and suck it back out again. You can use this stuff if it's a new mucus plug. You can do N-acetylcysteine, which is a smelly substance that has other medical uses as well, including for Tylenol poisoning. But you can you breathe it in, and it will dissolve. It will thin mucus like crazy. Oh, wow, okay. It's called a mucolytic. And then pulmonary toilet, which sounds interesting, but what that just means is cleaning out your lungs through percussion. So those are three kind of ways that you can treat one of those things. So. Anyway, so that's all good news. So, yeah.
Good stuff.
Thank you all. All right, very good. Enough of that. I sent you a bunch of stories over the break.
Well, you want to do the one that...
Johnny Long.
Johnny Long.
Yeah. Go ahead.
It was an atorvastatin and Co-Q enzyme 10.
Okay, well, that's not a question. You just stated two things.
47 minutes ago. I'm trying to find it.
He was asking if he should take coenzyme Q10.
Atorvastatin question again.
I got it.
I'm sorry.
Oh, it's okay. He what he was asking was if he's taking a statin drug for cholesterol, should he take coenzyme Q10 along with it?
His prescribing doctor did not. Yeah,
that's right.
Yeah, okay.
And here's the thing. I just found an article in the Auctioner Journal, which is not a shitty journal. It's a pretty decent journal, but it's from 2010, but it's old. But it's coenzyme Q10 and statin-induced mitochondrial dysfunction. So mitochondria are these little organelles in cells that look like bacteria, and guess what? They probably were bacteria at one point. Mm-hmm. And we are eukaryotic, human-type cells that had DNA in them needed something to generate energy, and so we formed this sort of symbiosis with this bacteria that now divides. It has its own DNA. Mm-hmm. It's passed down from the mother. And these things, they're really interesting little organs, and they produce energy for the cell. And if you have a primary or a secondary, in other words, a secondary deficiency would be one that's caused by something else. Mm-hmm. Primary would be if you just were born that way. But the deficiencies of coenzyme Q10, you can get neurologic and myopathic syndrome. So one of the hypotheses is that these HMG-CoA reductase inhibitors, aka statins, mm-hmm. cholesterol medications, interfere with the production of this stuff called mevalonic acid, and that is a precursor in the synthesis of coenzyme Q10. So you think, okay, so you have this HMG-CoA reductase inhibitor, you're going to end up with a deficit in coenzyme Q10, and a deficit in coenzyme Q10 can cause neurologic symptoms like peripheral neuropathy,
right.
But also myopathic syndrome, which is muscle aches and pains, and muscle cell destruction, both of which are known for statins to cause. So it makes some sort of sense. So what they think is that coenzyme Q deficiency is certainly one possible mechanism for statin-induced muscle pain. But what they found is that coenzyme Q10 supplements haven't really been shown to routinely improve that function. So they're saying that further research is warranted, blah, 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 blah. But I do think that it's okay to take it. I don't see a downside to taking coenzyme Q10 along with your statin. Can I tell that it's helped? I'll tell you one thing. I don't have the myalgias that I had. I can't say that it's from the coenzyme Q10, although those two things were temporarily related, so that is very anecdotal. But I can also say that my neuropathy, I don't think the coenzyme Q10 helped my neuropathy. What did help my neuropathy was taking all the other supplements like glutamine, alpha lipoic acid, and myo-inositol. Those things helped. And if you don't know what the fuck I'm talking about, if you have a friend that has peripheral neuropathy, just go to drsteve.com, and there's an article there on nutritional supplements for peripheral neuropathy that are backed by some data. It's not great. I'm not a huge, I don't push it, but I do recommend that people try it because it doesn't hurt, and it certainly helped me. I mean, I couldn't even stand in the shower and close my eyes without falling down. And then when I got on that stuff, it did go away. So that's something. So, but anyway, so I think, Johnny, it's okay to take it. There are conflicting data in the literature that are newer than this particular study. I didn't know if you were looking up some, Scott, but okay. Why would you? Why would you? I saw you over there typing. I'm like, okay, he's looking up some more recent studies. But whenever it's conflicting like that, it tells me that either the studies are poorly done or it might not have a huge effect. But I don't have a problem with you taking it. And I think the reason that a lot of primary care providers aren't telling people to take it is because it's still in the realm of hasn't been proven yet. It's not established science. But it makes sense.
Oh, yeah.
So the question is if the CoQ10 that you take by mouth can actually make it into the cells. Because if it can't, then you can take all of it you want. It's not really going to do any good.
Yeah.
Okay. So you have something from the waiting room?
Yeah, Bob was asking about Barrett's esophagus.
Bob Bobbington?
Bobby Bobbington, that's right. The Bob Bobbington, evidently.
Okay.
He was just saying that a friend of his about a decade ago had Barrett's esophagus due to acid reflux.
Yeah.
And at the time, his doctor recommending getting it checked every year with endoscopy due to cancer risk from it.
Yeah.
And? I would say that...
what was there a question?
That was the question. Does it disappear?
Oh, does it disappear?
Yeah.
Oh, sorry.
No, it's okay.
Yeah, it can.
Yeah, shoot you.
It's rare.
Mine did.
Yours did?
I mean, today they didn't say anything about mine being there. And I was told 25 years ago I had it.
See, that's the thing. These old diagnoses of Barrett's, it calls into question the diagnosis in the first place. But there are people that it will resolve in, but it is unusual. Usually it's a chronic condition. So, I didn't know that happened to you.
Yeah.
Wow.
Been battling a long time.
Okay.
Yes.
Yeah, so Barrett's can go, one of the progressions of Barrett's can be metaplasia, which is when you have cell types that are in the wrong place. It's supposed to be squamous cell, now it's adenomatous. And then you have an adenoma. Adenomatous just means that it's derived from glandular cells. And then it can go from metaplasia to dysplasia, which is precancerous, and then it can go to the naughty one.
The bad stuff.
Yeah, to malignant. Okay?
Yeah. Yep.
All right. But, yeah, it can. If you are good to yourself, every once in a while one of these things will just resolve on its own.
And honestly, I think a lot of it's dietary. If you can change your diet over time, your body might correct it. That's my thought. That's not science.
No, I'm with you. Losing weight, eating fruits and vegetables, eating a healthy diet is
seems to help.
Yep.
Lowering stress levels.
Yeah, good luck on that. Fuck yourself.
Oh, God.
I'm not having any trouble with that.
All right. Any other questions in there?
No.
That's it?
I
thought you had another one.
No. That's
Oh,
all.
okay. All right.
Oh, about the magic mushrooms?
God damn it, Scott.
Yes. Well, listen. There's 17,000.
He's got propofol brain.
There's 17,000 of them in here, so I'm doing my best. The question was from Diesel.
Well, okay, let me ask you a question, though. Are you taking notes about the topics that we're talking about today, or did you forget to do that?
No, thank God.
So then what you do is you copy and paste onto that, and then it'll be sitting there right in front of you. Mm-hmm. You see? That
Copy
way
and paste, Scott.
While I'm looking,
Copy and paste.
No, I'm just saying.
And while I'm looking up the other thing.
Okay, yeah,
okay.
with all the things you're not looking up while I'm talking about them, flailing my arms, going, Jesus Christ, help me here.
Well,
That's fine. I'm just messing with you.
I guess I can start looking.
No, hell no. They'll be yelling at you, too.
Oh, hell done froze over there, Taste.
He'll be yelling at you for it next.
I'm not yelling.
Hey, he'll yell at me.
Magic. Hey,
Jesus.
So Diesel.
It just won't do anything.
Diesel Child was asking about what are our thoughts on the magic mushroom studies?
Excellent.
Yes, I'd say excellent. I'd say, where are they? I need one right this very second.
A bit of a controversial view on this. I think Timothy Leary did us a disservice. I really do.
Right.
What happened in the 60s was all these kind of conservative thinking, not necessarily right-wing, but conservative thinking people in the United States, particularly those in research at the time, who at that time were wearing, pen protectors and had slide rules and shit, more big, thick glasses and had, flat tops.
Right.
If you look at the normal sort of lab person, then you see, our brethren, a bunch of fucking hippies at Woodstock, all zonked out on acid, and groovy man, and if you're going to San Francisco, anyway, that did us a disservice because people were like, okay, we need to make this shit illegal, and we're not going to pay for any research on psychedelics anymore because Timothy Leary just wants people to have trips and alter their consciousness, which at that time was considered a bad thing. Mm-hmm. It's taken until now for people to start getting grants where they can do research on psilocybin. Oh, just psilocybin. Mm-hmm. And, LSD research is kind of coming back. Mm-hmm. We'll have to go to clinicaltrials.gov and look. That would be a good thing to do.
Hang on. Let me get on.
Oh my
Let me
God.
copy and paste it first.
And put in PTSD and then just as the keyword put LSD and see if they're doing that. And then check DMT as well. But they're just now starting to do this stuff again.
What were we supposed to put in again?
Don't worry about it. Just don't put anything in.
Okay.
It's, God, fucking Jesus Christ. I'll do it in post. We'll do it live.
Type in blah 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 blah, and then type in blah 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 blah, keyword blah blah blah.
I'm flipping you double birds. Anyway, but if did you find anything there on studies?
A little bit.
Well, how many studies are there? PTSD and then psilocybin as the keyword, or LSD as the keyword.
Well, there's a couple pages.
Okay. It says at the top how many studies there are. It'll say
7,680.
Wow. Okay. So we're starting to see some research happening again, and that's significant amount of research. So ketamine has hit this. S-ketamine is now commercially sold, and that's a dissociative anesthetic that is now being sold as a rapid medication for severe refractory depression. We're going to see microdosing of psilocybin manufactured and sold for PTSD and other conditions. And I think that we are finally getting into the range where we're going to start seeing, because we're manipulating neurochemicals all the time with SNSRIs. We manipulate serotonin. We manipulate cannabinoids receptors. Why not hit some of these dopamine and other types of receptors in the brain with psychedelics? Yeah. And at very low doses, people aren't jumping out of buildings and thinking they're flying and stupid shit like that. It ruined this. Yep. The bad trip is what ruined this for everybody. The bad trip and just the image of all our brothers and sisters doing acid in the 60s completely stifled it. So I really feel like if Timothy Leary had kept things in the laboratory, we would be light years ahead of where we are right now. It's almost akin to the burning of the library at Alexandria, where we would have had calculus maybe 1,000 years before we actually got calculus if that library hadn't been sacked and burned. And, 1,000 years of calculus, would we already be traveling between the stars by now? I don't know.
And that comes from Spaceship Earth at Epcot.
What's that?
That story.
Oh, the Library of Alexandria did, but not the part about calculus.
Yeah, no, that comes from Steve.
No, it's Steve who?
Oh, nobody.
For fuck's sake. No, she's been doing propofol too. That's all right.
Can you get rid of it?
Oh, yeah, of course.
Will you?
Yeah.
I'm sorry.
Oh, I'm just holding something over your head. Good Lord. Okay, well, let's get out of here. Thanks, everybody. We're just sort of getting back in the swing of things again, and we'll do a better show next time.
Well, probably.
Definitely check out our Patreon, though. Patreon.com/weirdmedicine. It's fun. Thanks always go to Dr. Scott, Tacie. We can't forget Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Tepp, that Gould Girl, Lewis Johnson, Paul Ovcharsky, Chowdy 1008, Howdy Gooplug, Eric Nagel, the Port Charlotte Horror, the Saratoga Skank, the Florida Floozy, St. Pete Barkeep Blower, the Dolly Museum Diddler, the Ballet Bimbo, the girl with a genetic half-sister no one knows about, Percy Dumb, Roland Campos, sister of Chris, Sam Roberts, she who owns Pigs and Snakes, Pat Duffy, Bill the Cop, Keith the Cop, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, Holly from the Gulf, Christopher Walken's voice double, guitarist Steve Tucci, the great Rob Bartlett, Adam Goldstein, Cowgirl Vic, thank you for your service, Cardiff Electric, Casey the soil scientist, Carl of the Talipes Equinovarus, Carls.
Oh my God.
Producer Chris, the subreddit, shut up. The subreddit News Chick, a.k.a. That Brog, Crows and the Bukkake Queen, Jenny Jingles, the inimitable Vincent Paulino, everybody, Eric Zane, Trucker Andy, Tucker and Anita Dixon, Bernie and Sid, Martha from Arkansas's Daughter, Ron Bennington, and of course our dear departed friends, GVAC, Barry the Blade, and Todd Hillier, whose support of the show is always gracious and always appreciated. Check us out on SiriusXM, the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Forget it. 6 p.m. Eastern on demand and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Goodbye.